The success of Affina is highly dependent on the collective impact of our individual members and all the good work that they're doing. And the reason that we have the Affina Awards is because the Affina staff on a regular basis gets to see this work that's being done throughout the year. And we thought it'd be a great opportunity for us to recognize the membership that's doing this great work, but also to showcase the membership so that others who are part of this wonderful team can really understand and get the impact of the fact that they're part of something bigger.
Community Clinically Integrated Network is a group of organizations with kind of a shared value or goals working towards improving the health outcomes for a community.
More resources for our patients. It means more quality care, more efficient care, less miscommunication or duplication of services, and I think ultimately leads to higher quality of care.
So it's trying to maximize our resources and in the right situation and take care of the patients at the right time.
It allows us to establish connections with other physicians and specialists in the area to really promote the complete coordination of care for our patients.
We're in working collaboration with specialties, with the hospitals, with our primary care physicians, community services, to get the care that the patient needs when the patient needs it.
It's a great go-between between us, the insurance companies, and our specialists, just to help coordinate the care is essential, but also having a smaller group of specialists to work with helps me know those physicians, communicate directly with those physicians, and just have a better relationship, and that obviously promotes better patient care too.
The Primary Care Population Performance Award is given to primary care offices who rank in the top decile in their communities on patient-centered medical home designation through Blue Cross Blue Shield of Michigan. And we chose this because this is foundational work that is really going to help prepare us for the pathway that we take to risk in our alternative payment model contract arrangements. So achieving this is a high honor, especially to be carved out of the top decile, but it's really setting us up for success in the future of our programs.
I think in terms of the triple aim, it's trying to develop patient-centered care with a focus on high quality care, low cost, and looking at the patient as a whole and how they integrate within the community.
For Hackley Community Care Center, trying to use our guiding behaviors, so is it kind of asking a number of questions. So is it good for the patient? Is it good for basically the organization? Is it good for the staff? Is it good for the community? So asking those questions allows us to try to ensure that we're focused on the triple aim.
It's about personalizing healthcare for each individual with respect to the community and trying to maximize, again, the highest quality care in the highest risk patients and utilizing that further care in an appropriate manner using our guidelines.
Our main focus is the patient experience. I think looking and listening to our patients, incorporating quality measures has helped us achieve and excel in this area. Dr. Watkins leads with a great example with building relationships with all our patients.
We do have a care manager on site, and he is able to work with the physicians to provide that better care at lower cost for our patients. So our doctors who have very complex patients with many chronic conditions often consult with our care manager, who's able to then provide additional support to the patient who might need it.
For MFC, I think we look at the quadruple aim rather than the triple aim because we can't leave our providers out. We have to care for them as they care for our patients. We are taking care of our providers by doing flexible scheduling and giving them more support staff, so care managers, behavioral health case managers, scribes, and trying to make their day a little bit easier as well.
The Specialty Care Population Performance Award, similar to the Primary Care Award we just gave out, is given to specialists who have received top decile as patient-centered medical home neighbors. Again, in support of really building that strong foundation for us to move into a different pathway in healthcare than we've really ever been down.
We have a lot of different goals that we're working on simultaneously, but we always have that goal of providing the best patient care possible.
Our goals are the patient's goals, so the more we're in tune to what our patients need and ask for, the better we can be responsive.
The number one goal is to provide excellent health care, whatever the parameters are. And to do that, I think you need to have a proper culture in the practice. And the culture that we like to do is a culture that looks at each person as adding value to them as opposed to extracting value from them.
Our staff is very mission-minded. We have a culture of wanting to improve patients' quality of life, and that in and of itself is the challenge.
Here the culture is where I as boss value the employee because we're a team. And as we value the employee, they buy into what the passion that I have for healthcare is, and then we work together for the same cause.
We challenge our staff to not just come with problems, but to come with solutions. And by doing that, we're empowering them to help meet our patient needs.
We're sharing much more information with our staff than we had in the past, so I think what that translates, or the goal is I think it's empowering the staff to say, okay, here's how my job or role helps to participate and move these numbers.
What can we do to provide better care to our patients? What are the areas of opportunity for us to grow, and challenge them to really look outside of the normal day-to-day workflow to see what else we can do for them.
I'm really excited to talk about our next award, which is the Community Service Award. Working for a faith-based organization, we have a common glue that keeps us together, and that's our commitment to our communities, both improving the health of the community and giving back to those who are in need in the community. And the recipient of this award has really demonstrated going above and beyond and really representing and pulling together our core values. And I'm particularly excited, I promise I won't give it away, but I'm particularly excited that this award is going this year to one of our affiliated providers, because I think it just proves the power of us working together as a collective, clinically integrated network, and that together we're stronger.
I don't think that's a straightforward question.
Oh, messy, chaotic, confusing, exciting.
I think the future of healthcare is bright. I think there are a lot of changes coming our way with integrated networks and with electronic health record. And
We'll have unique partnerships, people you didn't think you were going to partner with to provide health care.
I see as having the patient being more actively involved in their care. We have our care managers who are working with our patients, and we work with patients with addressing their needs, their health care, with where they are at.
I look at healthcare as the whole person, but food first, looking at the environment people live in, looking at some of the barriers they face and some of the challenges.
Probably more screenings. I think we're going to screen more and more patients for things like social determinants of health.
Trying to identify these outside factors that might impede that patient from getting the care that they need and actually resulting in better outcomes.
As data comes out, we're utilizing it to the best of our ability so that we can anticipate disease before it becomes like predominant, life-altering for a patient.
Healthcare going forward is about more care, individual care, certainly for their medical ailments. I'm not saying that that's not important, but they need to know they're valued. Nobody cares how much you know until they know how much you care.
The Affina Anchor Award is really our capstone award, and I thought it would be really fitting to have Randall Homrich talk to you a little bit about that award, because Randall is really the reason why we're here and having an award program. It was really his brainchild.
Thanks, Sean. I really appreciate that. So we are actually awarding the Affina Anchor to an exemplary office that has exhibited all of the Affina Anchors, and those anchors are really important because they articulate who Affina is and why we're really here. It trickles down to being a healing, transforming presence in the communities that we serve. We hope that you as Affina members will also embrace those Affina anchors as well. So that's just one of the great ways that you can become, we can become a stronger, better network. So the Affina anchors are: be adaptable, embrace diversity, build relationships, have relentless curiosity, challenge the status quo, and blaze trails.
On behalf of Affina, I'd just like to extend a heartfelt thank you. Thank you for being a part of our team. Thank you for all of your hard work this year. And it's truly a wonderful experience working with each and every one of you.